Well, Profmed is commending the finance minister for his focus on funding as well as rolling out the COVID-19 vaccine. But the medical aid scheme says it's wary of how the funds will be allocated in order to ensure every cent is spent on vaccine procurement and distribution. Well, to talk more about this is CEO Mr. Craig Comrie, who joins me now. Thank you so much for your time. And I suppose, a lot of people have been worrying and, growing concern about transparency when it comes to the allocation of funds. And as far as the vaccine is concerned, why particularly is it also a concern for you?
Well, the previous indication from the Department of Health was that they requested medical schemes to also contribute to the funding of vaccines for non-members. And medical schemes as they stand are really set up legally only to provide funding to their own members. And so we felt that it was really important to understand not only just the request and how we could contribute, but also understand what the members would like us to do with their monies in terms of assisting the vaccine rollout program.
With that being said, when we talk about transparency, it goes hand in hand with accountability. Do you feel that government also has taken accountability as far as, the rollout of vaccines is concerned, the resources, the money that used to fund them? Is there confidence in trusting that they would own up should the need arise?
I think the positive thing is for the first time we see the contribution and the commitment from the government in terms of the funding of the vaccine program. There has been continuous engagement with the medical scheme industry and sharing of information throughout the procurement process, and business has worked alongside the Department of Health and the Council for Medical Schemes to put together and support the plan in terms of getting the vaccines to people. I think the concern would be that the 9 billion rand allocated in the budget does in fact reach vaccine procurement and distribution. And so we have to make sure that even though it's channeled through provincial and national departments, that it does all go for vaccine coverage. The critical thing for us at the moment is to get the vaccines sooner rather than later and make sure that the program is rolled out earlier than, I think, the 18-month anticipated timeline.
Right. Mr. Comrie, I wanted to ask you here about some of the opportunities that are there, in your opinion, between government and private sector to strengthen healthcare, particularly at this fragile time.
Yeah, there's no doubt that we need a national health system in place. From a medical scheme perspective, we think the success of any national health insurance plan comes with the support of medical schemes. And I think there's still lots of debate, and there has been lots of submissions in terms of how we could prove healthcare in South Africa for every South African citizen. So I think we need clarity and better engagement in terms of how that will happen. The long-term plan still means that national health systems get rolled out in decades and not a few years. And we saw for the first time some indication that NHI policies are going to be coming through in the next year or two. Effectively, that means delivery might come a lot later than that, but we need to understand with clarity what that policy means. And for the normal average person in the streets, it needs to be effective and make a real difference in their lives.
And part of your indications and data that you've received, I understand, include Profmed's, over 5,000 plus members who have participated in a survey that you conducted. Take me through what that survey aimed to sort of, explore and disclose, and what have you found?
Yeah, early on in the discussions with the Department of Health, the request came through that we contribute to the funding of vaccines. Legally, as I said earlier, it has been difficult, and medical schemes hold money in trust for members, and so we can't use it other than what members actually indicate us or give us the mandate to use it for. So we polled the members to see how they would like to contribute to the funding of vaccines. That's for people not in medical schemes. And so interesting enough, or as I think we expected, about 60% of our members actually indicated that they aren't prepared to fund vaccines for non-medical scheme members. I think that relates mostly to the size of the premiums of medical schemes, and they were worried that that would affect the premiums going forward. There was another 70% odd of the members polled that didn't want to use medical scheme monies to fund that. But what was quite satisfying, and in terms of the social consciousness of our members, we did see about just over 53% of members that indicated that they would be willing on a voluntary basis to actually donate money to a fund similar to the Solidarity Fund in terms of funding vaccines for those who cannot afford vaccines. That probably becomes a bit of a moot issue if you consider that we have, with the 9 billion rand budget set aside for vaccines, and probably around 2.5 to 4 billion rand medical schemes monies, which we will fund the vaccine for our own members. Right. There should be enough money to actually cover the 40% or the 40 million people in South Africa that are being targeted for vaccines.
All right, well, Mr. Comet, this is where we leave it. Thank you so much for joining us.